Hannah, thank you. August is National Breastfeeding Month, a great time to raise awareness and learn more about breastfeeding. Here to tell us a little bit more is Regional Breastfeeding Coordinator Megan Pate with the Northeast Tennessee Department of Health. Thanks so much for joining us this afternoon.
Absolutely. Thanks for having me.
Well, let's talk a little bit about some of the benefits of breastfeeding for both mom and baby.
Yeah, so breastfeeding is optimal nutrition for babies. It helps reduce the risk of ear infections, stomach problems, even sudden infant death syndrome or SIDS. For moms, it helps reduce the type 2 diabetes. It helps reduce ovarian and uterine cancer. So there's a lot of benefits long-term to breastfeeding for the dyads.
Well, I know that there are a lot of different things that folks can do if they are in that phase of life. What support programs does the health department offer for people that are breastfeeding, and how can they get in touch with those?
So all of our health departments have a private breastfeeding space. So whether you're there for services or you're just stopping by for like a birth certificate, we have a private space available. So we want you to feel supported. In addition to that, we do have the Women, Infant, and Children's Program, or the WIC program, to help support moms through their pregnancy journey and their postpartum journey. We have breastfeeding peer counselors, which are paraprofessionals. These are moms that have breastfed at least 6 consecutive months who've been through the trenches with us. So they know what you're going through. They are there to have that mother-to-mother support. So we are just there to support you in any way that we can and help you reach your goals.
Well, I know that there are a lot of ways that folks can also get involved with helping out in this realm. What are some things that the community can do to offer some support and help you guys out?
The biggest thing is educate yourselves. Talk to the moms that are in your lives. If they're breastfeeding, what can you do? But the biggest thing is just do things that you know that she's going to need, so she doesn't have to ask. So if you see her water bottle is empty, go fill it up, or bring her a hot meal. Do things that she doesn't have to stress about. Do the dishes. Just plan ahead. Grandparents, spouses, everyone can help out in one way. Taking baby after mom nurses, whether it be pumping or latching, can be a big help to her, so that way she can then take care of herself.
Well, I know that there are a lot of folks that might be in need of some information and some support. What can they do in order to get all of this?
They can call their local health departments. So any of our local health departments will have information on breastfeeding in the WIC program to see if you qualify. We also have the Tennessee Breastfeeding Hotline here. So it's open 7 days a week, 24 hours a day. Anyone can call. You don't have to be a mom. You can be a spouse. You can be a grandparent, aunt, uncle. You can be a medical provider. But it's staffed with international board certified lactation consultants. So they are very knowledgeable. They use evidence-based information and they stay up to date. In addition to that, we do have some breastfeeding events happening this month. Actually, next Friday, we have some happening in Washington and Unicoi County. So for more information on those events, just call your local health department.
All right. Well, thank you so much for stopping by with all this really great information. We appreciate you.
Thank you.
Yes. Well,